Hi, Ari. May I call you Ari?
You may
Um,
call me Ari.
Thank you very much. Um, this is an interview in anticipation. We're really excited to have you coming to this year's AFTNC conference, Friday, October 21st through Sunday, October 23rd in Sonoma County, California. And the title of the conference is All in the Family, Sexual Orientation Throughout the Life Cycle. So that's a great topic. And as you know, AFTNC is a wide ranging organization of seasoned clinicians and new people to the field. Um, so I'm going to ask you a little bit about the conference presentation, and you've split it up so that the first day is more about gender identity development, and the second day is more about transgendered, transsexual, and non-conforming gender identity stuff. Can you explain what people could expect in the two different
Sure.
days?
I actually, the first day is more about general LGBT identity development. So, not just gender identity, but sexual orientation and sexuality
Thank you.
issues in the family. And the second day will focus more on gender, transgender, transsexual, gender nonconforming, because words keep changing. By October, we might have different language that we'll be using. But my goal was sort of the first day is to look at life cycle issues and to look at everything from parents dealing with the birth of a child with an intersex condition, something we don't talk about a lot in our culture, to what it means to have a child who is growing up who may be exhibiting gender nonconforming behavior. How do we assess for that? How do we determine what is, I will say, normative gender variance and what is indicative of potential gender identity conflicts or potential trans youth identity as the child grows up. I just was running a support group last night for parents and parents of children ranging from age 7 to 40, because they're still children, right? They're still your babies, and dealing with trans issues. So dealing with lifestyle development, gay and lesbian coupling issues, gay and lesbian parenting issues when gay and lesbian folks are parenting, and looking at some aging issues. There's a brand new book that just came out on LGBT aging that I'm going to be integrating a lot of the work from that in. And then the second day will focus really on gender identity, and both from sort of a normative, what I call gender with a small g, male female development issues, and then moving into sort of some of the complexities that are coming up around transgender and transsexual identity that folks are bringing into therapy these days, with therapists who are like, I don't know where to begin. So even a lot of times very seasoned therapists have not really had a lot of experience around trans issues.
Uh-huh. Well, it sounds very exciting. I'm curious what what you might anticipate are some of the things that people who are just starting in the field would be learning or need to know, and then on the other end of the spectrum, what do you think some of the things, like you say, people haven't thought much about? What's kind of the range that people might expect?
Well, my experience, because I do a lot of teaching at colleges and universities, is that, and I don't want to make an assumption that younger students are necessarily young people, and because I recognize that some of us returning to school are not young in our years, that there's a diversity of that. But in general, younger people have a comfort around LGBT people and issues, sort of the post Stonewall generation, and they're comfortable with those issues. I had an experience with an intern this past year that I think is indicative of this. She's 21 years old. She just got her master's degree in social work. Maybe she's 22 now that she's graduating. Really supportive, heterosexually identified, lots of gay friends, was willing to work at the Pride Center, this out gay organization. I mean, totally enthusiastic and really alive. And 9 months into an internship, working exclusively with LGBT people, had a realization that part of me sort of wanted to bang my head against a wall, but I was glad she had it. And she said, like, she did an interview actually, and she didn't follow my rules because I told her not to do it with a friend, but she did it with a friend. And the interview, she came out of the interview going, "Oh my God, I really never thought about how much my friend sort of manages her life carefully because of her lesbian identity. That her and her partner think about what neighborhood they're in and where they're walking down the street and can they hold hands and will this apartment be a good place to live, and if I get this job, how will I come out at work?" And her friend is out, they hang out, like all their friends are cool around the issue, but it's sort of, she came to sort of a different level of really getting some of the stigma management that even people who are really out deal with. And for me, that was just, and when I said bang my head against the wall, I mean, what I mean by that is that on some level, I thought we were clearly talking about that the first week of her internship, the second week, but there was another level of an aha for her, another level of I have a privilege as a heterosexual woman that my friends are not having. So I'm using that example because I find that younger folks are incredibly open-hearted. They're not walking around with some of the biases, prejudices that some of us older folks might have been raised with. But sometimes it's actually a blinder.
Sure.
Because I accept that you're transgender, I don't get why you're worried about telling your boss, kind of thing. So that's on one side. On the other side, those of us who are long-term family therapists, been doing a lot of work in families, I mean, obviously have lots and lots of clinical background and clinical skills. But I find that many people, have never worked with a transgender client or have never worked with a, gay couple that's been together for 30 years that's dealing with cancer, that have never worked with, some of the interesting and complicated issues about those of us that are lesbian and gay identified, that are having children that are lesbian or gay identified. On the surface, it seems like, hey, that should be pretty easy, right? And it's interesting. It's not so easy. And people struggle in odd kinds of ways about, everyone's going to blame me for this. Some kind of almost a deep level of, is there something that I did to make my child this way? And, those are some of the kinds of issues that even I think really advanced therapists, we're kind of in a new turf here. The world has really changed. So we're all learning. And I want to be really clear about that I'm learning every day more about the population of people that I specialize working with.
Well, I think for people coming to the conference, if they don't have a language to be able to ask the question or an awareness that there's a potential issue there, then it's going to go unnoticed and just be part of maybe the problem of not being able to talk about it
that's a great example. I mean, perhaps somebody who comes into your office that is, I want to say, obviously gay. I mean, I don't know what that means. They're there with their partner. They're obviously out. They're obviously trans. That's one set of dilemmas. But the assumption is the people who come in not looking like that, those are not their issues. And if we're not asking the questions, I mean, I cannot tell you how many times over the last 20 years I have worked with somebody who has been a closet cross-dresser their whole lives, who has been through endless therapy, much therapy with people I respect, but never shared that. And in some cases, because the client was thinking, well, I don't think it really matters, or if the therapist needed to know, they would ask. I mean, that's kind of sometimes clients' innocence about that. But the therapist would never consider. I mean, that just was not part of their assessment. They would ask about your drug and alcohol use. They would ask about your childhood. They'd ask if you had children, but they don't necessarily say, so how do you feel about your gender, or ask questions that might evoke that kind of conversation. So, yeah.
Well, I am super excited to be able to hear more
Me
about
too.
this. One of the things that your bio and your resume that you sent us was huge. And if you were going to pare it down and be able to make our job easier when we introduce you in October. What do you want people to know about your work and what you're doing now?
Okay, that's a great question. So, and I'm in an interesting place in my own life because I'm shifting a little bit my job duties and responsibilities. So what I have been doing for many years is I have 25 years I've been teaching at the State University, New York, at Albany in the social welfare program, and I teach sort of generic social work and family therapy, but I also teach a sexual identity course and have developed a program called the Sexual Orientation and Gender Identity Project. And my hope and fantasy is eventually to make that into a certificate bearing program because, there's no place, there, I'm not going to say zero, there's very few places in the country where you can get advanced training on sexual orientation and gender identity, and certainly not through public institutions. So that's one of the pieces I've been doing, and I plan to continue doing. And I also have a private practice where I specialize in working with. I'm so sorry, this thing is just too big for my little head. So that you should know that about me. I'm 4'11". I'm tiny. People always meet me and think, "Oh my God, I thought you were big." So I am big, but I'm little. So it's clinical work. I do work with the families and family focused. I mean, I think that's one of the things that and I don't mean I alone. I don't mean that, but I and other people have brought to the field is the working with LGBT in a context of their families.
Uh-huh.
Does
And
did that make it shorter?
that makes it much easier to introduce.
Okay.
We'll pepper it with other accomplishments that you've already told us about in paper or electronically. And then is there anything you want us, the people coming to the conference, to think about in anticipation that might help it be a deeper experience when we get there?
Well, what I would like people to think about, I just challenged my class at Smith College yesterday with this question, is what is gender? I mean, what do we mean by gender? Are we talking about sex when we talk about gender? Are we talking about culture when we're talking about gender? Are we talking about identity? Maybe I'll leave you with this thought that people can be in same-sex relationships that are in cross-gender relationships, and people can be in opposite-sex relationships that are really in very similar gender relationships. And if people are scratching their heads now, I always tell my students, if you're more confused when you leave, then I've done my work. So if you're going, what the hell did that mean? That's probably a good thing. So that's the gender piece. But also, I guess the other side is, what is family? And what are the parameters of that? What are the boundaries of that? We both live in states where gay people can marry, but in most of the country, people cannot. And not all gay people want to marry. They don't all want to marry. And I think we have to look at some of those dynamics of, family planning, family building families, creating families. Our families are often formed through interesting reproductive technologies, through adoption, and are often biracial, transracial, and cross-racial. And that's a whole new family dynamic on so many levels.
Cool. Well, thank you very much for taking
Okay.
time out of a very busy schedule to sit down with us today. And I really look forward to meeting you in person in October.
Me too. I'm really excited.
Okay.
Great. Thank you so much.
Okay. Over and out.
Over and out.